My name is Lyn Stewart. I'm a physical therapist at Capitol Rehab in Arlington. Today I'd like to help you demystify a little bit about IT band syndrome. IT band syndrome is a common cause of knee pain in runners and athletes. The pain, the IT band, begins at the hip and it runs down the side of the leg, attaching below the knee. It is also attached to a muscle at the top side of the hip called the tensor fasciae lata. What happens is when this tendon is overstrained, it will cause inflammation at the bony area down below the knee, giving the patient pain. Many patients come into us having already tried to treat the symptoms of the knee pain using ice, stretching, maybe using a foam roller. They've tried decreasing the activity or how much they're running with little or no effect. What they're actually doing is they're treating the symptom, which is the pain. What we here at Capitol Rehab want to do is we want to treat the cause of the pain. What is causing the overuse of that IT band? So to do that, we will do a biomechanical assessment where we will look at your functional movement and how that IT band, what stresses are being placed on it during functional movement. Whether certain muscles, we can look and see if certain muscles are being inhibited, meaning they are weak or not communicating and getting the signal from the brain to contract. And we can see if certain muscles are overactive or tight. These are called muscle imbalances. When we look at a runner, what we may see is during the heel strike or mid-stance, we're going to see that as the leg is being loaded, there may be a collapsing at the hip, which causes the thigh to move inward, rotate inward, causes the knee to have a medial or inward movement, the tibia, lower leg, also rotating in, and increasing the amount of pronation into a prolonged period at the foot. This is a cascading effect down the leg, when the real cause could be a weakness that was first began at the hip. Most commonly, that weakness is in the gluteal muscle, the glute medius. When you are running, say a 10-mile run, you may take 150,000 steps at 3 to 4 times your body weight. That is a lot of stress being placed on that tendon over and over when it's not aligned properly. So that is why the stretching, the ice, the foam roller did not take care of the problem, because you were only addressing the symptoms, not the cause. So how would we address this? We would look to improve the strength and the firing ability of the gluteus medius specifically through corrective exercise. We would help you get neurologically to isolate that weak muscle and get the muscle firing and woken up, and then move into functional training that simulates your sport or your running activity so that that muscle will be active while you are in that loaded phase, decreasing the stress down the leg and on the IT band. I hope this helps to answer some of your questions. If you would like some more information or like an evaluation, please feel free to call us at Capitol Rehab at 703-527-5492.